McLennan, and I'll be showing you how to do a trait change / maintenance today. So first I'm going to do is I'm going to walk in, I'm going to do my hand hygiene, I'm going to introduce myself. Hello, my name is Reid. I'm a student nurse here today. I'm here to change the dressing around your trait as well as change your inner cannula. So I need to verify that I have the right patient. So I'm going to check it, ask this patient if they can speak. What's your name? Perfect. They tell me their name and their FIN or birth date. Good 2 identifiers. I know the wristband. Wendy Holmes, FIN 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 6, 7, 8, 9. 35 years old, Dr. Jackson. Perfect. So I'm not the right person. My orders require that you take care of 4 hours PRN and they're at 40% humidification cold pot. So I verified I have the right patient. Next what I'm going to do is I'm going to verify that I have all my supplies / safety that I need. So first thing I'm going to do is I'm going to make sure the bed is elevated to semi-Fowler's position for the patient, and then I'm going to look on the side here. So first thing I'm going to verify is that my suction is turned on. And I want to verify that it's up to between 80 and 120 when I cover it off. So I'm going to turn it down a bit, make sure it's within the range. There we go. It's within 80 to 120, so we know we have the right suction that we're going to require for doing the suction. Next, I'm going to make sure that we have normal saline. We have an extra trach set here. We have the inner cannula, we have the outer cuff, we have an extra tie, we have dilators as well. So we just want to make sure that there's anything here in case of emergency where the trach needs to be changed right away. Next thing we check is the oxygen. So this person requires 40 liters of cold pot. So again, it's set at 40, which is correct. And at 40, it requires 10 liters of oxygen. This should be at 10 liters of oxygen. It's a little short as the room, but it will be at 10 to make sure that's correct. Last thing I'm going to check to make sure there's an ambi bag there in case I need rescue ventilations or the patient needs assistance for their pre-oxygenation. So the first thing I'm going to do is I just want to make sure that I open up my simple dressing kit, so that way I can not have to be leave the oxygen off for too long off the patient. So I'm going to open the top, the side, making sure that anything that goes past the edges is then not sterile anymore. Remove the blue from there and expose my field. Next thing I'm going to do is I'm going to remove the drape and the garbage bag, which I'm going to lay down, and then I'm going to take out my tweezers using no-touch technique so they are ready for the cleaning. Push those to the edge, and the blue ones can go on the outside as well. I'm going to then set up my garbage bag, or have the garbage bag below, either or will be fine. At this point in time, I'm now going to, again, make sure my hand hygiene is correct. For any trait care we do require that a mask is worn, possibly the face shield or not. At this point in time, I'm just going to verbalize it so you can hear my voice and I'm not speaking through the mask, but I would be wearing a mask at all times. So I'm going to be adding more supplies to my sterile field, just so that I'm not short throughout this process. Make sure that I keep my 1-inch border sterile. Make sure everything stays in. So I need to add a couple more 2x2s for cleaning. And then I'm going to be adding a 4x4 for drying. And last but not least, I need to add a couple of IV site bandages, which is again to go replace the one for the tray. So butterfly that open. Perfect. And last thing not least, I'm going to add a little bit of sterile water to my tray for cleaning. Make sure I don't drip it anywhere. And last but not least, I'm going to be adding 2 Q-tips. Yes. 2 Q-tips for clean. Making sure that the swab is within the 1-inch border so I can use them. I did touch the tip of these with my finger, so I will now remove those from my sterile field as they can no longer be used. And last but not least, I'm just going to open my sterile cannula. So now I'm going to apply my gloves. So the first thing we're going to do is we're going to need to suction this patient. Put 2 gloves on. That's another part of the safety check that I would like to specify, is making sure that we have lots of extra suction catheter tips near the patient, so if they do need suctioning, it's right handy. What I'm going to do now is I'm going to tell Wendy, okay, so we're going to start prepping for the suctioning and then changing your trach dressing. First thing I'm going to get you to do, we need to pre-oxygenate the patient. I'm going to ask them to take 2 to 3 deep breaths, which helps bring their O2 sats up. We're also going to have a monitor on their finger. We just want to make sure that the patient doesn't become hypoxic as we do the suctioning or the trach changes. If so, we may need to add oxygen back to this patient to make sure that they're well oxygenated. As well, I can also make sure that I turn the oxygen all the way up so the oxygen level they get is of greatest concentration. So this time, I'm going to remove the oxygen from the patient. I'm going to get my suction line. I'm going to connect to the top. Down on the ground as I don't know if it's clean. I'm going to remove my suction catheter. What I need to do is I need to keep the last 5 to 6 inches of this sterile. So I'm going to make sure that I don't go any farther. So what I'm going to do now is I'm going to tell Wendy, okay, Wendy, we're going to suction here. So what you're doing for suctioning is you're holding it the 5 to 6 inches away. And what you're going to do is you're going to insert it into the trach without touching the sides until you meet resistance with the bifurcation. At that point in time, you're going to start suctioning. So you're doing intermittent as you turn your finger, maximum of 10 seconds in an adult. So you would do that once. You can only use these suction catheters once at a time. If there is further suctioning required, you will need to use another suction catheter. After this, my gloves are dirty, so I'm going to turn the suction catheter into this inside of my gloves and remove those gloves and clean my hands again as we have just dirtied them. I'm going to clean my hands. I'm going to reapply a new set of gloves. So we've now suctioned. Now what we're going to do is we're going to remove the inner cannula from this old trach. So we're just going to grab the tab. We're going to pull it out. We're going to twist it and remove it. This is dirty now, so we are now going to get rid of these set of gloves. For a quick hand hygiene. Now we're now going to put on a third pair of gloves. These are clean. As we will be doing touching sterile objects, we do not want to possibly dirty the new trach. So the new trach, we are going to have it open. We're going to maintain sterility. When we are grabbing the new trach, we have to make sure that we do not touch the cannula. We can only touch the little tab that's on the top of it. So as you can see by me grabbing it here, I'm just touching the little tab on the top. I'm not touching the outside of the cannula that's going to be inserted. So to insert it, you're going to go to the side and you're going to twist it in. And insert it in until it clicks. Make sure it's clicked. So we're good there. So we've inserted this new sterile cannula. What we're going to do now is we're going to now clean around the outside of the trach before we put the new dressing in. We're going to remove the old dressing. At this point in time, we're still monitoring those sats. We're monitoring for the SpO2 changes. We're noticing if that patient's short of breath or hypoxic. We're going to the new set of gloves on that are clean. Alright, once these gloves are on, I'm going to take my sterile Q-tip applicator. I'm going to get it wet as I want it now clean. What I'm going to do is I'm going to hold this tie in place. I'm going to go closest to the stoma hole, and I'm going to do one swipe around with the wet Q-tip. After that is garbage. I'm going to grab the next one, wet it, dab it dry. I'm going to do just the top now, the top half. Clean there. So now I've cleaned the top and the bottom closest to. At this point in time, we now want to clean a little bit more around the surrounding areas, as the bit dressing will touch more than just that. So I'm going to make rosettes. We're going to wet it, and we're going to pat it out. I'm going to do the bottom clean. And I'm going to drop that. I'm going to get another one. Wet it, dab it out, make sure it's not too wet, not dripping anywhere. And we're going to do the top of the trach all the way around. So now we've done the top and the bottom. Now, after we've done that, we need to dry it. So I'm going to use a 4x4 for this to pick the most moisture. I'm going to go all the way from the one side to the other, drying it.
Once more because I contaminated, so I would
Last but not least, if I got that wet, I would remove my tray, but I did not get it wet, so it's good for drying. And I will now do the top. So just with a little bit of movement, I'm going to now dry the top and get rid of that. The next step is I need to now redress the site around the stoma. So we're going to take one of these IV dressings. We're going to maintain the sterility of the inside edge. So we're going to fold this over. This one touched my hand, so I would now remove that. It would not be part of my set. So I'm now going to pick this up. I'm going to lay it underneath the trach. Perfect. First, I'm going to make sure that's tucked in there and tucked in there. I'm going to put these down. And for the last bit, I'm going to use my hands and just on the outsides of the bandaging, not touching the middle. I'm going to make sure that I wrap the trach dressings around the stoma as occlusively and tight as as possible, making sure I maintain that sterility of the inside edge, only touching the outsides. And I apologize to the patient for being close to their face and touching it. Okay, so now I've done the complete dressing change. The dressing is clean. At this point in time, I'm going to reapply oxygen to this patient, check their sats, check their vitals. And then before I leave, I'm going to do the safety check, make sure the rails are up, make sure the patient's comfortable. And then the last thing I'm going to do is I'm going to document the dressing change, any sort of mucus I pulled out, how much possibly, is there a list, is there a lot, is there a little. I'm going to document any skin around the stoma site, making sure that I specify that it looked good or intact. And I also just discuss about what size cannula I used and any other products I use for this dressing change. That's how you do a trach dressing change.